Are you or a loved one dealing with chronic obstructive pulmonary disease or COPD or asthma? If so, you might have heard about Trelegy Ellipta, a once-daily inhaler that's making waves in the treatment of these conditions. This innovative medication combines 3 powerful drugs into one easy-to-use inhaler, offering relief to many. In this video, we'll delve into the top 10 facts about Trelegy Ellipta. What is Trelegy Ellipta? Trelegy Ellipta is a once-daily inhaler designed to help people with COPD and asthma breathe easier. It combines 3 different medications into one device, making it a convenient option for those who need multiple treatments. The 3 medications are fluticasone furoate, an inhaled corticosteroid or ICS that reduces inflammation; umeclidinium, a long-acting muscarinic antagonist or LAMA that relaxes the airway muscles; and vilanterol, a long-acting beta-2 adrenergic agonist or LABA that helps open up the airways. This combination works synergistically to reduce symptoms of COPD and asthma, such as wheezing, coughing, chest tightness, and shortness of breath. If you're managing these chronic conditions, Trelegy Ellipta might be the all-in-one solution you've been looking for. How does Trelegy Ellipta work? Trelegy Ellipta works by targeting different aspects of respiratory health through its 3 active ingredients. Fluticasone furoate, the ISC component, is essential for reducing inflammation in the lungs. Inflammation can cause significant swelling and mucus production, which narrows the airways and makes breathing difficult. By decreasing this inflammation, fluticasone helps keep the airways open and reduces the frequency of asthma attacks and COPD flare-ups. The other 2 components, umeclidinium or LAMA and vilanterol or LABA, work together to relax and open the airways. Umeclidinium blocks certain receptors in the lungs that cause muscle contraction, while vilanterol stimulates receptors that cause muscle relaxation. This dual action ensures that the airways remain open for a longer period, improving overall lung function and making breathing easier throughout the day. What are the approved uses of Trelegy Ellipta? Trelegy Ellipta is approved for 2 primary uses: the long-term maintenance treatment of COPD and asthma in adults. For COPD, it helps manage chronic bronchitis, emphysema, or both by reducing symptoms and preventing flare-ups. This can lead to fewer hospital visits and a better quality of life for those affected by this chronic lung disease. In terms of asthma, Trelegy Ellipta is approved for adults who are not adequately controlled on inhaled corticosteroids and long-acting beta-agonists alone. If current asthma treatment isn't quite cutting it, this combination inhaler might be the next step your doctor recommends. It's designed to provide consistent relief and keep asthma symptoms in check. What is the dosage and how is it administered? Trelegy Ellipta is incredibly user-friendly. It's taken once daily, making it a convenient option for those who might struggle with multiple doses throughout the day. For COPD, there is a specific strength available, while asthma patients have 2 different strengths to choose from. Your healthcare provider will determine the appropriate dosage based on your specific condition and needs. Administering Trelegy Ellipta is straightforward. Simply take 1 inhalation at the same time each day. Whether you prefer mornings or evenings, consistency is key to maximizing the benefits. Just remember, it's important not to take more than 1 dose per day. If you miss a dose, take it as soon as you remember, but don't double up the next day. How effective is Trelegy Ellipta? Trelegy Ellipta has been shown to be highly effective in clinical studies. For COPD patients, it significantly reduces the rate of moderate to severe flare-ups and improves lung function. One major study involving over 10,000 patients demonstrated a 25% reduction in annual flare-ups compared to using Anora, a LAMA or LABA, and a 15% reduction compared to Brio, an ICS or LABA. Additionally, Trelegy users experience a notable improvement in their forced expiratory volume or FEV1, a critical measure of lung function. Asthma patients also benefit from Trelegy Ellipta. Clinical trials over 2,400 participants showed significant improvements in lung function over 24 weeks. Compared to dual therapy with Brio, Trelegy provided a 110 ml improvement in FEV1 at 24 weeks for the lower dose and 92 ml improvement for the higher dose. These results highlight Trelegy's potential to enhance breathing and overall respiratory health for those struggling with asthma. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. What are the side effects? Like all medications, Trelegy Ellipta comes with potential side effects. For COPD patients, common side effects include upper respiratory tract infections, sore throat, pneumonia, and bronchitis. Other possible side effects are headaches, back pain, and gastrointestinal issues, like diarrhea and constipation. Asthma patients might experience similar side effects, including runny or stuffy nose, urinary tract infections, and flu-like symptoms. It's crucial to note that Trelegy Ellipta is not a fast-acting inhaler for sudden breathing problems. It doesn't work quickly enough to treat acute asthma attacks or COPD flare-ups. Always have a rescue inhaler on hand and seek emergency help if your breathing worsens rapidly. Also, if you have conditions like glaucoma or severe milk protein allergies, consult your doctor before using Trelegy. What are the potential drug interactions? Trelegy Ellipta can interact with a wide range of medications, which may either decrease its effectiveness or increase the risk of side effects. Notable interactions include strong cytochrome P450 3A4 inhibitors like ketoconazole, certain antidepressants, beta blockers, diuretics, and other anticholinergic drugs. If you're on any of these medications, it's important to discuss them with your healthcare provider to avoid adverse interactions. Always inform your doctor and pharmacist about all the medications you're taking, including prescription drugs, over-the-counter medications, vitamins, and herbal supplements. They can help review potential interactions and adjust your treatment plan accordingly. Being proactive about medication management can significantly enhance your safety and the effectiveness of your treatment. Are there any special considerations? Certain group of people need to take special precautions when using Trelegy Ellipta. Pregnant or breastfeeding women should discuss the potential risks and benefits with their healthcare provider, as it's not fully known whether the medication can harm an unborn baby or pass into breast milk. Additionally, if you have severe allergies to milk proteins, Trelegy Ellipta may not be suitable for you. Other conditions to consider include glaucoma, heart or liver problems, high blood pressure, diabetes, seizures, and osteoporosis. If you have any of these health issues, make sure to inform your doctor. They may need to monitor your condition more closely or adjust your treatment plan to ensure you can safely use Trelegy Ellipta. What are some tips for using Trelegy Ellipta? Using Trelegy Ellipta effectively can make a big difference in your respiratory health. Aim to take your inhaler at the same time every day, whether in the morning or evening, to maintain a consistent level of medication in your system. This routine helps keep symptoms at bay and provides 24-hour relief. If you happen to miss a dose, take it as soon as you remember, but never double up on doses. After using Trelegy Ellipta, rinse your mouth with water and spit it out to prevent thrush, a common yeast infection in the mouth. Store your inhaler at room temperature and keep it dry. Write the date you opened the inhaler on the label to track its usage, as it should be discarded 6 weeks after opening or when the counter reads 0. What do patients say about Trelegy Ellipta? Patients' testimonials can offer valuable insights into the real-world effectiveness of Trelegy Ellipta. Many users report significant improvements in their breathing and overall quality of life. For instance, some COPD patients have shared that they experience fewer flare-ups and hospital visits since switching to Trelegy. They appreciate the convenience of a once-daily inhaler that combines multiple medications. Asthma patients often highlight similar benefits, noting better control over their symptoms and fewer nighttime awakeness due to breathing difficulties. While individual experiences can vary, these testimonials underscore Trelegy Ellipta's potential to make managing chronic respiratory conditions more manageable and less disruptive to daily life. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!